Well, good morning. This is such a great, we're here today and we're so glad and fortunate to have, today we have James joining us. James, tell us a little bit about you and what you do.
Sure. My name is James Coomes. I'm a licensed clinical social worker. I'm a program manager with the Los Angeles County Department of Mental Health. And specifically, I work at a place called the Olive View Community Mental Health Urgent Care Center located in Sylmar. And we are a crisis walk-in center along with the 24-hour unit. And what we do is we fill the gap between outpatient mental health care and emergency services, the type that you would get like at a hospital.
That's great. And of course, we have Jonathan too. He is our AmeriCorps fellow with our health service department. So Jonathan, hello. How are you?
Thank you for having me. I'm very excited to have James here with us and give us some information to our clients.
This is great. Well, thank you, James, so much for joining us today. We're so excited to be able to do this. You know, during this whole time with the pandemic, we've had to, stop. A lot of times we would invite you to be at our distribution times to be able to talk to the clients directly. So we're grateful that we've been able to take this virtually. And it's also great too, because we can reach a wider audience as well and talk about the things that we're doing at the center and how everything, the programs that are available for the community. So we're so grateful to be doing this. And this month, we are celebrating we're celebrating Black History Month this month for February, as well as we did Heart Health Month and then Lunar New Year. So we wanted to really focus though this month, this week, we're doing a big focus on different health issues that address the community, especially in the African-American community with Black History Month. So why don't you tell us a little bit about what you'd like to talk about there?
Sure. So we can start out talking a little bit about who we serve through Los Angeles County. Our most recent data comes from 2019, and we typically serve a subset of folks in the county, the public mental health system. We typically serve a subset of folks that are eligible for Medi-Cal. And there's about 10.2 million residents in Los Angeles County, and about 8.1% of us identify as Black or African American. Altogether, the Department of Mental Health itself serves about 250,000 people per year. We need to be careful comparing apples and oranges, because we know that 1 in 4 people are in need of mental health services at some point in their life. So with a population of 10 million in Los Angeles County, that would come out to actually 2.5 million people. We're serving about 1/10 of that right now. And then of that 250,000 people that we serve annually, about 35,000 folks identify as Black or African American. This is understandably significantly important to me because one of the things I experience in the clinic where I'm at is we have roughly in the system, I think it's about 27% of the folks we serve in the public mental health system identify as Black or African American. But there's a personal connection as well, where when people walk in the door to the clinic that I'm at and I meet people when they first walk in, it does make a difference for folks that identify as Black or African American to see somebody that looks like them greeting them at the door. So diversity matters, and being able to identify with the folks that we're serving matters as well.
Great. That's good. And so it is important because, especially I know at our center, we really want to work to keep a diverse group as far as our staffing, our volunteers, because we're there to help. We want to help our community, and it's really important that people feel comfortable and feel that they're being served and they can identify with our staff and volunteers. So that definitely is very important. What are some of the biggest issues that you seem to be tackling in the community?
Well, one of the largest issues in serving the Black or African American community is around stigma, about making sure that people have access to the care that they need. And unfortunately, there's a very long history, as we were talking about at the beginning of the conversation, is demonstrated by what we're seeing this last year with all of the social justice movements going around Black Lives Matters and a lot of the anti-racism initiatives and anti-oppression initiatives that we're in the middle of right now. Within the Black community, there is a history of stigma around accessing services, and there's a couple of different sources for that. If we look back in the development of mental health services in the United States alone, a person by the name of Benjamin Rush is kind of considered the father of American psychiatry. He was a signer of the Declaration of Independence. He helped start to develop the concept for the modern mental health system. He was an abolitionist. He also identified a term that he called negritude. And what that was is that was a condition that was ascribed to Black people that was akin or a subset, if you will, of leprosy. So there was a labeling from very, very early on in the mental health system in the United States that Black people, African American folks, had experienced, were experiencing something different, had a different set of mental health conditions than the rest of the population. After that, when we moved into abolition and the ending of slavery, there was actually mental health conditions that were ascribed to Black people, to slaves and former slaves, that had a desire to be free. The desire to be free was actually considered a mental health condition at one point in time for part of our population. We've subsequently seen a number of systemic racism issues and social justice movements. As late as the 1960s, a medication that's on the market now, we still use today, it's called Haldol, and it's used for psychosis. There were actually advertisements that depicted angry Black men, which was justifying the need for Haldol. So you had these images in the media that Blacks or African Americans had a greater need for more significant, more serious mental health need, not a greater need, but a demonstrated more significant mental health conditions than the rest of the population, which actually played into stigma to help people access services. If we look at today, and if we compare the folks that are receiving services in the public versus folks that are incarcerated, 40% of today's, the people that are incarcerated today identify as Black or African American, whereas there's only, I believe it's 13% of us in Los Angeles County is the population. So we are overrepresented in our jail systems. And if we look at diagnoses around things like schizophrenia, that type of a thing, Blacks and African Americans are often diagnosed at a higher rate with schizophrenia and other psychoses than their white counterparts. And so going back to that Haldol advertisement from the 60s, there's a suggestion that anger and aggression are somehow mental health problems in the Black community, whereas they're more accepted in other communities, and therefore people aren't accessing the services that they need because a lot of folks believe there might be something really wrong with them if they need to access mental health services. So we're trying to correct that. We're trying to make sure that we get more access to all services out to the entire population, including the Black community, and to try to level that playing field a little bit. Coming back to the systemic racism piece a little bit, there's a large movement right now going on to try to, around the justice system, and to try to help get more folks out of the jail system so we can hopefully they can access more services in the community so they don't need incarceration as much. And the system, our society doesn't believe that people need incarceration for some of the same behaviors that their white counterparts are demonstrating publicly in the community. So there's a long history of stigma around access to mental health care for the Black community, because there's a label that there must be something wrong with us if we need access to care. And then what happens is we don't get the access to care that we need, and we end up suffering greater consequences than other parts of the community. So we do have a problem here, and we are actively working to try to provide more services like ours and more opportunities to access services like yours as well. You described having your constituents come in to access services and asking to have resources like ours available to help the public understand what's available to them so they don't have to end up in a crisis in order to get the care that they need.
Well, and that's great what you're saying too, because it's so important to, when you see a problem, not to wait. If you can access the services, to try to be more preventative until it gets to the sooner you can intervene, the better, is what I think.
Yeah, absolutely. Absolutely.
Mm-hmm. Jonathan, did you have anything else? Other questions you wanted to interject?
No, I think that James went through it really well. I agree with that we have to do more to target our African American communities. And as someone in health services, I really hope that we continue doing that. And we want to work with DMH on doing that more often. So yeah.
Well, I think so too, because when we've done our surveys with all of our clients, that this is one of the services that is most, that the request that people would like more access to mental health services, and also wanting it So we know that there's a need, and we know that people really would like to access the services. But I think in not just the African American community and other cultures as well, there is the stigmas, and how do we get past that and make it? And I think it's just being more welcoming and having it just be talking about it like we're doing now, because the more you talk about it and get it out there, it's no longer something mysterious or nothing that's not a negative. You have to make it a positive.
There's a book I read a little while ago called Radical Hospitality. And I actually, what you're doing by reaching out to the community is demonstrating that radical hospitality, is letting people know, not just opening the door and putting out a sign, but proactively letting people know that they're welcome and we're here to help. That's exactly what you're doing.
Yes, and that's what we really work hard to know, because we are an essential service in our community. We're here to help, and we're all about neighbors helping neighbors. And the sooner we can intervene and show that the services are there for you. And with the Department of Mental Health, it's not even a matter of cost, because I think that's what people worry about when they see that they might need that, or they think of having to go to a psychologist, having to go somewhere. They think of cost factors a lot of times. Yeah. And there's services are out there without you having cost free or low cost. Mm-hmm. So I think, and so can you tell us a little bit about that? Or
sure. And of course, nothing is free. It'd be great if everything was completely free, but it's not. What we have is we have there's for every person that comes into services through the public mental health system, we do have a financial screening process. It's called an UMDAP, or Universal Method to Determine Ability to Pay. So we accept Medi-Cal. If somebody has private insurance, what we'll do is we'll actually work with the individual to help them access the mental health resources that are available through their private insurance system. So we don't want somebody thinking that they can't access it all and we can't help them. If they don't know where to turn, they can come to us and we can help get connected to the appropriate resource. As a side note, for private mental health, there is mental health parity, or private mental health services, there is mental health parity with insurance companies. So there should typically either be the same access line or a separate behavioral health line that would be on somebody's insurance card that they can access that. But again, we can help with that. If somebody's in crisis, if somebody's having thoughts of hurting themselves or hurting somebody else, that should be a non-issue. We want to do what we can to keep somebody safe. We can't be effective with anything else we do if we can't keep somebody safe. So that should not prevent somebody from accessing the public system. Little side note, this will age me a little bit, is part of the UMDAP process. There is, for folks that do have what's called a share of costs, we do use a sliding scale. So that might feel like it deters people, but here's the good news. The sliding scale hasn't been updated since I graduated from high school in 1989. So the system is accessible. And if for some reason there is a financial hardship to be able to access services, we work with individuals to either try to make that work out within the system or help them get the care that they need through a partner system or partner service, including their own private health care.
Now, what would you say? What is a good tip you would say? Say there's someone out there who maybe is struggling themselves, or if you have a family member that you're really concerned about, what is your biggest tip you would tell them to do right now? Or what's your biggest
the first thing I would suggest is don't delay. One of the reason we exist, and I'm happy that we're able to do what we can do in our crisis center for the community, but what happens is that someone may delay going to their community outpatient mental health center, and is part of that delay because they're thinking they don't need services, or there might be stigma associated with the services, or whatever it may be. And the problem is that little issue can become a big issue, and it can become a crisis. And next thing you know, somebody may need our services. They may need to go directly to the hospital. We do have some resources I'll provide you in a moment as well about how to access emergency services that come into the field as well. If everything were working right, we would want people to get services at the first moment they identify that they might be experiencing a mental health issue. It would be even better for somebody to be concerned about having a mental health issue, going to an outpatient clinic and finding out, no, they're okay. They don't meet criteria because they don't have a significant issue, which that in of itself can be can alleviate some of the stress and anxiety associated with accessing mental health services. So we really encourage folks to come in and to access those services. There's a network of services that can be identified through the Department of Mental Health's website, which is dmh.lacounty.gov. And then there's also a phone number. It's called we call it the Access Center. It's kind of gone through some different names at different times. Let me make sure I've got the current name for you. It is the LA County Department of Mental Health helpline. And that phone number is 854-7771. And what's really cool is there's the Access Center, which will help somebody identify a local mental health agency near them. They have an emotional support line. They can actually call and just talk with somebody on the line there if they just need to bounce some thoughts off of somebody to check in. If they're not feeling okay, there's someone that they can talk with, and that's available to them. We also actually have a veterans line as well. So for veterans that are experiencing any kind of a mental health crisis or trauma or whatnot, they can access care through a veterans line. And that line is actually staffed by veterans and by loved ones of veterans that have kind of been there, done that, so they know what's going on.
Now,
so
is that,
go ahead.
Oh, is that on your website, the DMH?
Yeah, that's all on the website. That's all on the website.
So let's give that website again. So
sure. It is dmh.lacounty.gov.
And so DMH stands for Department of Mental Health. Mm-hmm. So DMH. Okay. Give it one more time, just in case.
It's okay. dmh.lacounty.gov.
Got it. Okay, great. So please, everyone, check that out. There's a lot of great information on there. If you didn't catch those numbers, you can go onto that site and see those numbers and that you may need, or you can refer them out to anyone that you feel might be needing the assistance. And of course, at our center, at Foothill Unity Center, our health services staff are available there for any questions, or if you can't find the number or something, they can help you navigate or refer you. But please, if you are in need or you have family members in need, please reach out. We're here there are so many resources out there for help. Don't wait, don't delay, as James was saying. Main thing is don't delay and get in there and talk and get the resources that you need. Anything else you'd like to add, James, that maybe we didn't cover? Or?
Well, there was one question that was asked of me earlier about what are specific resources for African Americans in terms of mental health. And this can be a tricky one because just like there's not a large number of Black or African American providers providing services. We are part of a larger system. And I described the experience of somebody coming into my clinic and kind of seeing me and being able to identify with me, which helps them feel more welcome. Sometimes that's hard to do in different service systems. And so I wanted to share a couple of resources that are available as well. And you can get these off of the internet. And actually, that's probably the best place to get more information about these, but this is a place to start. About a year or so ago, Self Magazine Online published a list of 44 resources for Black people to address everything from mental health issues to a lot of the crisis that was going on over 2020 and now. And so there's a number of resources there. Black Lives Matter actually publishes a list of resources as well. And I've seen that pop up in a number of different places. And these are nationwide resources. Most of them are available online. But they help identify local resources as well. And then the last thing, and this happens on a regular basis, is word of mouth. There is an informal network of Black or African American mental health providers, and we don't know each other. We don't know each other. It's not like we all got together last Thursday or anything like that. But it's not uncommon for me to get a call asking for a therapist or a service provider that can provide a specific type of service, and we do what we can to try to connect people whenever we can. There is a reality though, and one of the things that we want to see is we do want to see more BIPOC folks, Black, Indigenous, and other people of color, go into these professions to be able to provide these services. The last numbers I saw with the American Psychological Association was that 98%, actually, I've got to be less than that. The vast majority of registered psychologists with APA are white. And about 2% of their psychologists that are part of their organization identify as Black or African American. We need to increase those numbers. At the very least, we need to find a way to increase those numbers to meet and match what it is the population is that we're serving, which would help us all out a long way.
This is such important information that we need to share. And it's great that we're able to do this during this month, but it's important throughout the year. It's great to focus right now, but we want to make sure that this is out there throughout the year, and not just our clients, but the greater community knows that this is available. And we're so grateful for you to share all this information. And we will also put out the website with their information out there to share, because this is so important. Any last thoughts you'd like to share, James, or anything?
Couple of other resources I wanted to share, and there's specific reason for this. One of the numbers I want to share with you is the National Suicide Prevention Hotline, and then also the crisis text line. The reason I want to share those with you is because we know in the Black community, Blacks and African Americans are less likely to complete suicide than whites, but Black and African American teenagers are more likely to have suicide attempts than their white counterparts as well. So we know that, for example, for crisis, we know that there is a need out there to support all of our communities. And so two the numbers that I wanted to provide one was the National Suicide Prevention Hotline number, Lifeline number, which is 800-273-8255. And this is a crisis line specifically to address suicide. There's also the crisis text line, and you can text LA for Los Angeles, text LA to 741-741. Want to make sure that those are out there because, again, as I mentioned earlier, we can't do anything to help people unless we can keep them safe. And so that's really where it starts, is we need to make sure that folks are safe, and then we can help them access the greater network of resources available.
Are you able to put that in the chat at all on there? So
yeah, I'll go ahead and let me see if I can type those in real quick.
Mm-hmm.
I will actually.
They're great resources because we want to have it out there, and then when people watch us or rewatch us, they can also see that out there too. And we also always try to put out this information. We do hand it out during our drive-through distributions, as all of our food distributions has gone through drive-through. And when our building is traditionally open, we have all this information posted in our client rooms, waiting rooms, and so we try to make this as available as possible.
Great. So what I've done is I've put in the chat the LA County Department of Mental Health helpline with those resources that we talked about, the crisis text line, and the National Suicide Prevention Hotline. And there are more resources available at the DMH website at dmh.lacounty.gov.
Great. Please, if you're out there, just visit. There's so many great resources, and James just gave you a lot of great resources right there. You can visit their site, find out things. If you didn't catch it on here, you can see it on the chat, or you can just go to the website, and a lot of these resources, all these resources are on there for you to find out. Anything else last minute that we'd like to catch before we end the interview?
Really appreciate you having me here. And one of the things that I also appreciate is the work that you're doing, because you may be reaching out to me for Black History Month, but you've already demonstrated that the work you're doing is 12 months a year, year-round, every season, and that folks are able to access your services the same way they're able to access our services year-round. So I appreciate being here today, though.
Well, we're so appreciative to have you, James, and to have you, interact. And we want to get this out to the community. But again, we want to really reiterate to everybody out there, don't delay. Just get the service. If you think you know somebody, if it's a family member, a friend, yourself, not saying anything is not doing anything. So, help, give the resources. At least you can put it out there for somebody. There's so much out there. So don't delay. We're here to help. There's so many resources out there. James just gave you a lot of resources. Foothill Unity Center is here to help, and it's all about being there for the community and people helping people and neighbors helping neighbors. So thank you so much, James, for being with us today. We're so appreciative, and our health services department is so grateful to have partners like you that really we can connect our clients with. So thank you so much for being here and being part of the community and doing all the dedicated work that you do.
You're very welcome.
Thank you.
Thank you.
All right.